Good afternoon, everyone. I'm Mohammed Abaji from the Washington University School of Public Health. And welcome to Bringing Science to Society, a conversation with Katelyn Jetelina here at Washington University in St. Louis. We're delighted to have you with us here in person. I'd also like to extend a warm welcome to our online audience. We have a little over 700 people joining us from around the world. We're pleased that you're part of this important conversation. Just a few housekeeping items before I invite Dr. Ashbak to officially welcome you. We ask that you please silence your devices and note that this event is being live streamed and recorded. For our online participants, we encourage you to please engage and use the chat function. We'll try to incorporate the questions into our Q&A. Also, there will be a reception right after the fireside chat here at the Clark Fox lobby, and would be honored if you can join us for that as well. Now, to officially welcome you and kickstart the proceedings, join me in welcoming Dr. Chris Shabak.
Hi, everyone. Thanks for being here this afternoon. I'm Christopher Schaberg, Director of Public Scholarship here at WashU, and I'm very pleased to welcome Dr. Katelyn Jetelina to our campus. Dr. Jetelina is a leading voice in public health. Her #1 science Substack, Your Local Epidemiologist, reaches over 428,000 subscribers each week, and Jetelina has thought deeply and strategically about this kind of impact, how the platform has become, in her words, a node in a massive grassroots diffusion network. Jetelina's newsletter is a source of trust, a forum for earnest conversation, and a beacon of clarity. I was so inspired listening to Dr. Jetelina speak with our WashU scholars in small meetings earlier today. One of my favorite things Katelyn said this morning was that we need more imagination at this moment. I couldn't agree more. This is a classic example of how plain language can get something exactly right. We need more imagination, especially when it comes to rethinking our role as a university in these volatile times, and we shouldn't shy away from this challenge. Dr. Jetelina is here to talk specifically about what this means for public health and science communication. I want to thank the School of Public Health for their partnership in hosting this event, and I also want to thank my indispensable team in the Office of Public Scholarship. At this point, I will turn it over to Dr. Jetelina, whose talk will be followed by a discussion with the Margaret C. Ryan Dean of the School of Public Health, Dr. Sandro Galea. Thank you again for being here today, and please join me in welcoming Dr. Katelyn Jetelina.
Thank you. Hello, good afternoon, everyone. Thanks for having me. I always joke that the silver lining of a pandemic is you no longer have to explain what an epidemiologist is, that we're not skin doctors, but we are disease scientists. And I have been at the forefront of the field for the past 15 years. And really have stumbled into this space of scientific communication. And so I wanted to walk you guys through a few of the lessons I've learned along the way in trying to navigate a very magnetic storm and trying to find a North Star as I did it. But my story began in March of 2020. I was a run-of-the-mill epidemiologist at an academic institution going up for tenure. And, I knew how to run data. I knew how to build models. I knew how to issue alerts. I was in the policy space, but 2020 was unlike anything I had ever imagined. And the virus was one emergency, but something that developed incredibly quickly was another emergency that I saw, was the lack of timely, understandable, and empathetic and actionable information that people could use today to make decisions, right? How to keep your kids safe. Should I go to work? Can I visit grandma after she gets a vaccine? And our institutions, right, the ones designed to inform and to protect, were incredibly slow. They were way too cautious. They're very inaccessible. And so into that void rushed misinformation, falsehoods, rumors, confusion, and a whole lot of fear. So I started writing. My dean came to me and she's like, Dr. Jetelina, can you just update our faculty, staff, and students on like what the heck is going on? And I did. This was one of the first emails I ever did. And they're really ugly Excel graphs I put in these emails, a few sentences long, but I just really told people what I was watching in real time. I assigned these emails, love your local epidemiologist, because that's who I was to them. And then I was telling faculty earlier today, a few days later, one of my students came to me and she's like, Dr. Jetelina, can you just please put this on social media so I don't have to keep copying and pasting your emails for my family and friends? And I distinctly remember turning to my husband and I was like, what the hell? I only have to do this for like 6 weeks max. And then surely someone's going to pick up the baton and actually explain to the public what is going on. And that didn't happen. So the Facebook page grew and grew and grew. This was eventually hacked by anti-vaxxers. Then I went to a newsletter style, and this newsletter has been my home for the past 5.5 years. It has reached hundreds of millions of people across 132 countries. But I think the theme of all of this was never in the playbook, right? It wasn't easy. People continue to tell me to stay in my lane. I have received hate mail. I have people still show up at my house all the time. But I kept going because I knew and I still deeply believe that the public deserves better. They deserve better information, better transparency, and a better bridge between society and science. I will admit, in this moment right now, feels eerily familiar to 5.5 years ago. This storm of really deep uncertainty for our field and for the public, one that can be incredibly disorienting, and one in which public health and research were under really enormous strain right now. And as angry and as scared as I am, I also know this, that if we are being honest with ourselves, like truly honest with ourselves, many of our systems were built for a different time, and they haven't kept up with what Americans need today. And so when I look in this moment, I see ourselves at an inflection point, particularly in public health, where we can either double down on what we know, right? The old systems, the old ways of doing things, or we can listen, we can learn, and we can evolve. Both of these instincts are understandable. I will say even both of these instincts are necessary, so we don't move backwards. But we also need to move forward and provide an alternative pathway than the one we are currently on. So for me, at least, I'm far more interested in this reimagining and figuring out better ways to serve Americans where they are now, not where we wish they were. And I did this with my newsletter 5.5 years ago. I'm doing this today too, thinking around innovative solutions and programs to really push the envelope forward in information ecosystems. And so while I still try to navigate this very magnetic storm that I also found myself in 5.5 years ago, I've really started thinking and coming back to 3 main principles to help provide a North Star. And so I wanted to share them with you guys because it may be helpful in thinking more on that offense rather than the defense. The first one is be trustworthy. So everyone right now, literally, I'm going to conference after conference of like, how do we build trust? How do we just get them to trust us? And I think that, and you know, it's rightfully so. Everyone's looking at the same data, right? That we're seeing a decline in trust in science, in institutions, in data, in what is the truth itself. But the challenge with this is that Trust is not declared, but it is demonstrated. It is demonstrated over and over and over again, and it's demonstrated through a set of acts. And so we have the credentials, right? I have the credentials, but this is really only one part of the equation. America doesn't just need experts, they need people that they can trust. And this, again, is done through a set of acts. Some of those acts are clarifying uncertainty. As scientists, we're terrible at doing this. We are taught as scientists and as physicians that we're supposed to know everything. We are the experts, so we should know everything. The problem is that's just not the truth, right? And that is just not even how science evolves over time too. And so science is never finished, and especially not during an emergency, and especially when we have a ton of unanswered questions. So one part of being trustworthy, particularly in communications, is really sticking to this framework that I always try to stick to, is what do I know, what do I not know, and how am I finding answers? And if you stick with these three things around communications or your science or your research, and you're honest, you will never be wrong. And not only will you never be wrong, you will be able to bring the public along for the scientific discovery ride. So when the evidence does shift, and it probably will shift, that others are able to pivot. This is a huge mistake that was made during the pandemic. It is not bringing people along for the ride, as well as not owning up to mistakes. The other part of being trustworthy is building trustworthiness is through empathy. Remembering that there's always a human on the other side of communications. People remember more of how you make them feel than what you actually said or what your data said. And so this is built in how we talk to patients, it's how we engage with communities, it's how we talk with students, it's how we debate, it is how we show up. And so that means things like this cartoon, right, will not change behavior. Shame-based messaging will not work whatsoever. This was also, we saw this over and over and over again during the pandemic with certain words like absurd or insane or bizarre. So do not use words like this. And we really need to think through framing, especially to people that are hesitant and especially to people that believe in conspiracy theories. Because when we respond without empathy in a very disconnected way, people are going to double down and they're going to reject our data even more because their views are linked to their identity and the tribes that they're a part of. And we need to build new foundations of trust. And that really starts with empathy. The other part of trustworthiness is built through revealing authenticity. Humans trust other humans. Humans do not trust brick walls. They do not trust the CDC logo, and nor should they. But the problem is, as us scientists, we're taught to take all emotion out of data. The problem with that is it makes it really boring for everyone else. And so we need to show up, to be human, to have your voice come through. Every time I hope someone opens up my newsletter, they hear a voice and they hear a person behind that really, really cares and is really curious. It's also consistency and keep showing up reliably over and over and over again in small and usually unglamorous ways. Trust is a practice. During the pandemic, this is like pictures seared in my mind. It was Mike, Tedros, and Maria who came up every single week on this panel to give updates from the WHO around the COVID pandemic. I got so used to seeing them every week that I then started questioning why Maria started curling her hair differently, right? But like, you just got to see them and they showed up every week. And even they showed up when they had no updates. And they show up and they said, we have no updates, but we want to answer your questions. And they started answering questions from questions they were getting in through Facebook. And so it's human, it's consistent, it's warm bodies, and it's also credible voices as well. And I think that this is also another huge mistake that we make, response after response after response, is we don't get to see the scientists behind responses. We don't get to see who's actually making really hard decisions and asking us to make hard decisions on ourselves. So we're about 20 years behind in public health around this. We aren't meeting the moment. And because of that, people are making laps really fast around us. This is why we see right now that the people with the most influence on our health, especially among young kids, 18 to 34-year-olds, are 2 times more likely to say they know as much as their doctor right now. We also see this in who is spreading health information, right? There's a reason why I say that Joe Rogan is the biggest scientific communicator out there. It may not be the evidence I want him to follow, but it's because he has earned, one, the trust of his audience. He's earned legitimacy with his audience that he has built over 15 or 20 years. This takes time. And then he communicates, and over again, it's through relevance, it's through frequency, it's through empathy with his audience, it's accessibility, relatability, and proximity. And all of these things then gain influence over how people make health decisions today. So there's a lot we in public health need to do to get here. I think one of the first things is, as scientists, we need to learn how to speak in plain language. Again, we could improve on this. We get really stuck in the numbers and the world of unable to translate innovation and progress and even value of our work. And so when we say something, it is completely heard differently from the public. What I really love is what Albert Einstein says, is that if you can't explain it simply, you just do not understand it enough. And we need to get better and better and better at explaining our work in plain language, why it's relevant to the end person and why it matters and what people are supposed to do about it. One of the biggest lessons I learned during the pandemic was never underestimate the public. Sure, they do not know what bivalent vaccine means. They also don't know what a wastewater surveillance system means, but that doesn't mean that they don't deserve to know, and it doesn't mean that they don't want to know either. We have to do better at balancing nuance with understandability, and this is an art form, and it's something that we need to teach and we need to integrate into all of our classes. Another thing that we can do is meet people where they are. People are not going to university websites to look at a press release. 1 in 2 Americans, even 1 in 2 rural Americans, are finding their health information on social media. We have to meet people where they are. The problem is when we try to do this, it completely flops because we're not thinking creatively on how to show up on social media. It's very bland, it's not very exciting, and we can get a whole lot more creative on how we present our science, how we start engaging with the communities online and in the physical world. But across all of this trustworthiness, one thing that I keep coming back to, especially in this moment, is that becoming trustworthy means showing up and communicating and fighting for the people, not for science with a capital S, not for our tenure, not for our NIH dollars, not for our institutions that employ us, but truly fighting for the patient and fighting for the people. And everything that you communicate, whether it's on LinkedIn or it's an interview with your New York Times or your local newspaper, always frame it around why this field is beneficial to the people, not necessarily only to the institutions. The second lesson that I've learned, or principle that helps me find a North Star, is to listen and then speak. Listening does not mean agreeing with everything. It doesn't mean validating falsehoods. It doesn't mean dropping evidence. It doesn't mean leaving your values behind, but it simply means understanding, like truly understanding what drives people's fears and frustrations and questions and hopes. Because if we do not listen, then we will continue to build systems that overlook the people that we are supposed to serve. And if we keep missing them, decisions about public health will be made without us in the room, and we are already living through those consequences. So the reality is that, a lot of people are focused on mis and disinformation right now, right? How do we combat that? But I see it more as the tip of the iceberg, that truly one of the reasons why we have so much mis and disinformation is what's from below the surface. It's questions, concerns, and confusion that people can't find answers to from trusted sources. Sure, they can Google anything, right? You can Google anything. The problem is that people don't need more data and more facts. They need storytellers, they need narrators, and they need navigators. And they're really looking for us and people to help process this overload of information as we go through. One way to learn about questions, concerns, and confusion is you have to open up a two-way street with an audience, with your community, with your research subjects, with whoever that you are working with. And that means that instead of listening, or instead of hearing, you're truly listening. And it also means that you need to go ask questions. You need to go look for questions. You need to get feedback. And most importantly, especially in this moment, you need to read, listen, and watch something that you disagree with. And to understand where people are coming from, and it'll help us be better communicators in this moment. One of the hardest two-way streets that I have explored over the past 6 months is with MAHA grassroots leaders. I have been meeting with them over the past, like I said, 6 or 7 times. And because I wanted to understand, I truly wanted to understand where their fears and frustrations were coming from, so I could help be part of the solution, an evidence-based solution, rather than some solutions I certainly did not agree with and do not agree with still. And what's beautiful about listening and opening up a two-way street is that it's purely relational instead of transactional. You have to build a relationship over time. And with that relationship comes really cool stuff. For example, I co-developed top 12 FAQs on childhood vaccinations with MAHA. They gave me so much constructive feedback on how to make this better, on what words resonated, they didn't resonate, on what other questions that I missed. And we co-developed this together. And after I said, hey, thank you so much, this was so helpful, let me go send it all to my YLE audience. But what they did without me even asking is then they sent this through the entire MAHA network. And so what happens when you start co-developing and creating these relationships is that you build this two-way street, and it can be beneficial to you, but more importantly, beneficial to communities. Part of listening, so that's listening, and then we have to speak, right? Because we have our own truth. We do have expertise. Expertise is not dead. The challenge is, though, that the traditional models of this ivory tower top-down approach to information flow is out of date. This just does not reach all the households. And so what is needed right now is more of a dynamic participatory model in which there's a lot of humility, in which, hey, the trusted messengers actually probably is not Dr. Katelyn Jetelina on PBS NewsHour, right? It's probably the pastors and the education boards and the school nurses and neighbors and friends and business leaders. And so how can we equip these trusted messengers to take a message, to create their own message, that we give up some control so that we can improve communication around public health? Part of this dynamic model is also this listening, is how do we create feedback loops back to the trusted messengers so we can still be responsive to the needs on the ground and meet people where they're at on the topics that they care about. I guarantee you a lot of communities right now aren't caring about vaccines, but a lot of the public health communications right now is vaccines. So how do we meet them where they're at in this time as well? The final piece of navigating this magnetic storm, and I have for you, is to be brave. We are not going to be going back to 2019. We are not going to be going back to 2024. And if there's anything I can do about it, we're not ever going to be going back either, because the status quo wasn't working. It can be better, right? We are not here to preserve broken systems. We are here to reimagine what they can be and help empower and move health into a better direction than we are in this moment or have been over the past 10, 20 years. You will face resistance. You will feel overwhelmed. I often do, of being brave and courageous in these moments, but I really hope that all of us can figure out be brave enough to imagine a better future. That doesn't mean you have to create a newsletter like YLE. It can be in very small doses. It can be in how you create a dashboard differently. It can be showing up in the comment sections of WashU social media posts. It can be hosting community events like science storytelling. It can be very small moves, but the more we move and the more we're brave to do something different, the more that we can come out and be less stuck. Because I feel like right now there's a whole lot of paralyzation, particularly in public health. So, bringing science to society, 3 things that I have learned is that there's many acts of trustworthiness, that we need to listen and then we speak and then be brave enough to reimagine. The task ahead of us is to really pull the curtain back, right? What was working? How do we humanize the systems? How do we connect the dots to lived experiences? How do we let a new generation of thinking really thrive and be empowered to innovate in this moment? Because this is how we rebuild trust, right? It's how we create value. It's how to ensure that people not only see public health, but like feel public health, like the whole reason we got into this in the first place. And so I really invite you guys to go back to your teams, go back to your jobs, go back to your data systems or the institution, and really try to think creatively on how we start getting this offense going forward. It's the work, right? It's not just, this title of this talk, and it's, I think, the legacy that we're all building together in the moment. So that is it. Thank you.
Thank you, Katelyn. That was terrific.
I think I went over time.
No, you were
Okay.
you were actually perfectly on time.
Okay, good.
Which is very unusual. So thank you. I really like your trustworthiness, listen and be brave. I'm going to ask you a question about each of those to start. Okay.
Okay.
So let's start with trustworthiness. So talk us through what's your playbook for actually signaling uncertainty. Like how do you communicate uncertainty, like your ranges, scenarios, and how do you do that in an ongoing way? I'm uncertain today, I think X. Tomorrow, I'm still uncertain, I think X plus 1. How, like, practically, what are you doing?
I mean, practically, it's what, it's what do you know, what do you not know, and how are you finding answers? I think that this is a really great example of how we continue to make this mistake was the disastrous press release around Tylenol and autism among pregnancy. That press conference was a disaster, right? The challenge, though, or what I was watching unfold, though, was the counter was completely on the other side of this pendulum, where Tylenol is 100% safe and effective. You should pop it anytime you want when you're pregnant, and do not worry, there's no fear. And I think that like, I got really frustrated seeing that unfold because that is something that we saw over and over again during the pandemic. And really the truth is somewhere in the middle, right? Like the science is still a bit unfolding. Yes, it doesn't look like it's not causation, there's correlation, but I think that people deserve to be walked through that evidence. They deserve to know what our unanswered questions are. And they deserve to feel empowered. And so I think with uncertainty, it's walking people through. I think it's also risk communication. People really appreciate understanding what the risks and benefits are. And people also want to know like what I'm doing with my family and bringing that human aspect to it to make these hard decisions. One benefit I have is I can then go back the next day and say, hey, the science changed, right? Like, let's go. But this was, again, something I think we continue to make, whether it's masks during the pandemic or natural immunity or, you name the subject during the pandemic, is that people love nuance. They love nuance, and never to underestimate underestimate the public.
Okay, now I have even more questions.
Okay.
Let me ask you about Tylenol first. I was not going to ask about Tylenol, but since you brought it up, so at some level, right, to have federal officials entrusted with health in particular agencies standing up and saying, we recommend X based on imperfect evidence should be unremarkable. I mean, we do that all the time. I mean, data are always unremarkable. So at some level, to have the head of the FDA saying, we recommend that pregnant women not take Tylenol should be unremarkable. Now, that press conference you call disastrous, I think that's a consensus view among many. It strikes me that, like, why was it disastrous? Well, it was disastrous. It has to be because trust has broken down, that this process, which should be normal, did not seem normal. So why is that? Like, what brought us to that moment? Dissect that moment as to why we think that moment did not serve the public well.
I mean, I usually know that from text messages I get from my girlfriends of like, I'm pregnant, do I need to take Tylenol? I mean, you could feel the confusion afterwards. So it wasn't necessarily that, I think that what the mistake was not trusting the public with the nuance of the science, that there is nuance. I think that that press conference underestimated the value of clear communication. It was kind of like a squiggly line touching all sort of topics. And then I think it also didn't recognize the ripple effects that having a microphone and a megaphone can have on truly confusing topics. There's many ways I would have done that press conference different, but I think though that what we can control is how we respond in the moment. And I would like us to step up a bit more in our responses.
So you said something else right now. You said, not to underestimate how important nuance is and how important it is to be honest about what we know and what we don't know. But go back to COVID, go back to 5-6 years ago. I can't tell you how many times I was in conversations, and I'm sure you were in as well, where people in our circles would say things, well, but people just need to know. We just need to be clear with people. So my question is, where on earth did that come from? I found myself banging my head against the wall time and time again. Like, why do we think that people need to be told?
I think it's the communication 101 that's taught, or it's always been traditionally taught, is that all you needed in the 19th and 20th century was the perfect string of words, and everyone would listen to that and act on that. The problem is we're in the 21st century, and how information flows and who has microphones and who doesn't the landscape has completely shifted. And so we in public health haven't shifted our understanding on how communication needs to shift in the moment as well. So I think what is needed, facts and data are not, you can, like I said, Google it anywhere. But the fact is that people really want to they want to know that nuance and they want to understand. And I think if we don't do that, we undermine the public's intelligence, and that ruins trust.
I've thought many times, I'm very glad I had never written about health communication before, because everything that was written was all wrong, and now we know it's all wrong.
Well, it changes. Well, but it changes. Like, I think we have to give ourselves some grace too, right? Like, I don't know if that top-down ivory approach was wrong in the 19th century. Like, it seemed to work pretty well, right?
That's a long time ago.
It was a long time ago. Just the information landscape has changed, and we need to adapt to it. The problem is that we haven't adapted. And still think that, a lot of people still think that we don't need to adapt to a network of networks effects, and we don't need to build new infrastructure, and we don't need to put human faces to things. And I think that that's incorrect.
So let's go to universities for a second, because you're in a university, you spend a lot of your years in a university. And one of the questions which I get not infrequently is from people early in their career trajectory is, well, what should I be doing? Like what should I early in my career be doing, be it postdoc or early career faculty? And you listed some things earlier, but I think we struggle with this. I think we struggle with what is the responsibility of the individual academic versus the responsibility of the collective, of the academy as a whole. And I'm actually curious, you have this vantage point in the academy, out of the academy looking in from outside. What are your thoughts on that?
I mean, I have a lot of thoughts. We're going off our script or questions here.
But we discussed that.
No. I think that, one of the biggest frustrations I had as an assistant professor was a few things. One was the incentive structure didn't allow this innovative entrepreneurship impact that I wanted to have. I was going up for tenure. My newsletter was a bullet point in community service on my CV. It's just not measured in a way. So there's not really an incentive structure for faculty to do this. And I think that we can do that through a lot of leadership. I think we can change the TMP process. I think we can have a different H index for like impact index or whatever. I think also we need to start teaching it within our curriculum as well. The other thing I think we need to realize is, and it's okay, is that this isn't for everyone, right? And I think that's perfectly fine too. I think it's figuring out how to empower others if they want to go into the arena, and how to support that through a carrot and stick approach.
Yeah, I think the point that's not for everyone seems critical, right? It's like this distinction of what each of us as individuals need to do versus collectively. Let me ask you about your third point, which is to be brave. And I really like the point, watch something you disagree with. And, I think what you've been doing with Mahat is really, really interesting. So congratulations. Lead us through habits of mind. Like how should we be reading or consuming media in a way that pushes us outside of our comfort zone?
Your blood has to boil. And that's how you know you're reading that thing. I mean, topic every day and writes what the left is talking about and what the right is talking about, right? So that's what I'm saying. It doesn't get my blood boiling, because it's just more of situational awareness that I really appreciate, to understand how I'm going to talk about a subject like Tylenol or like healthcare costs or whatever. I listen to Joe Rogan every single time, and I also subscribe to Free Press. And I deeply try to understand how topics are being talked about, like what the framing is. as well as how people are thinking. It's a lot what I did during the pandemic. I helped with the response in Texas, and I will forever be grateful for being an epidemiologist in Texas during the largest emergency that we've ever experienced, because this California girl was taught and forced how to listen. And that will forever make me a better epidemiologist. And I think that this is a really important time to be listening if we're going to be reimagining systems for the better.
You know, when you mentioned Joe Rogan, and when you were speaking, my thought went to how far we've come in the past 5-6 years. In my book Within Reason, which you gave a very kind review to, I mentioned Joe Rogan, and I can't tell you how much crap I got from our community for even mentioning Joe Rogan. That was 2023, not so long ago. But today, you can say Joe Rogan is the most important health communicator out there.
Well, yeah, don't quote me on that, but yes.
I mean, and to all 700 people on Zoom, do not quote us on that. Go on.
No, but I mean, I think that this is, I'll just be honest and frank. I mean, your book gave me a lot of courage to speak up of what I thought needed to be done differently. And I think that the more that people speak up and the more we start thinking outside the box and the more we give ourselves permission to, the better off we are as a field. And the more interest we will get from other perspectives, and the more that we can make the public's health better, because public health is for everyone's health. And I think it's deeply, deeply important to have an open mind.
Let's talk a little bit about your local epidemiologist. I mean, what you've done with that is just remarkable. Really, congratulations. So lead us through, how do you actually think about different audiences? How do you think about segmenting audiences, different risk messaging, different communication the challenge with communicating for the public is enormously heterogeneous. How do you think about that?
Well, you have to know your audience. My audience is not the general public. I was telling faculty earlier today, 70% of my audience is MDs, PhDs, right? Like, we're not talking to the general public. And, I think that's really important. It's really important to understand how people use your information and where it's going to go for their own communications. And so I don't really segment the audience. I think I just really hyper-focus on who is receiving my email and what would be useful or interesting or helpful to them. And they can take with it what they get. I think one thing we need to do a whole lot better on is risk communication. This was something that I got really frustrated about around H5N1 last year, was like, is this a alarm 5 emergency for my sister, or is this like no big deal and every epidemiologist is freaked out but no one else, right? And so I think we need to so when my communication, I try to do that risk communication for the trusted messengers for my audience to then communicate out to their audiences as well. And so I don't know, I don't really segment. Maybe I do need to segment, but
no, you're the expert. I don't know.
Yeah, but it's Communication 101 is, who are you talking to? And really crafting the message for that audience to use and feel empowered.
Let me ask you a little bit about empathy. You made the point when you were speaking, and you've made it in other places, about avoiding tribalism and leading with empathy. So lead us through a little bit. What specific message frames or phrases have you found reliably reducing defensiveness? And conversely, what might backfire?
So my biggest tip on this is that words matter. Like, the literal words you say matter. So for example, in my newsletter, you will never see the word misinformation. That is a trigger word. And so I use falsehoods or rumors. There's I had breakfast with Senator Cassidy like 2 years ago. And I was talking about pandemic preparedness. And he like looks at me and he's like, Katelyn, I don't care about pandemic preparedness. I care about biosecurity risk, right? So like, he was teaching me in the moment that like the words matter on what resonates for that person. And so if, you know, if you asked any of the co-authors of my newsletter, they'd probably get really annoyed from me about like how I look at every single word and how it's going to resonate. But truly, it's really important if you want people to keep reading what you're writing. And so I try to lead with empathy. That also means no shaming for thinking of anything, or, you know, having a certain question. No question is stupid. And it's listening to those questions and being responsive to them.
It's something which I struggle with, and I think sort of the academic world struggles with. How do you balance engaging with politics as necessary without being partisan?
This is not on the list either. So public health is inherently political, right? I wrote on LinkedIn the other day that public health is often seen politics as the third rail, right? Don't touch it lest you get burned. The problem with that is that the third rail provides power to the train. It determines how we get our funding, who's making decisions, what decisions are being made. And so I don't think that you need to take politics out of public health. And in fact, I think you need to lean more into it. The question is about partisanship, which is a little different. And I don't, you know, I try to stay nonpartisan. One way I do that is really try to speak to where my frustrations are, not to label things. People can read between the lines, right? But like, if you start naming, or if you start pointing fingers, that's only going to get your tribe really excited. And sure, that'll get you viral. I know how to go viral with my tribe, but that doesn't meet the other objective, that I want to reach other people and have them listen to me as much as I'm listening to them. And that is sometimes extremely hard in moments like this, but it comes down to what your objective is and what you're trying to accomplish. And there are value of our tribe going viral, right? Like, I don't want to break that down for people that are really good at that. But to me, it's another pathway I've deliberately tried to take. Another thing I do is really listen to constructive feedback. I'm really proud that my audience is actually pretty across the spectrum with politics, with social and fiscal political leanings. And so when I get a message like, you are such a liberal tard or whatever, right? It comes in after my email. I literally ask my team, I respond to them back and be like, that's really interesting, because I feel like I could have been a way more liberal here. Like, can you tell me why? Like, what were the words or the topic that really made you feel this? And we get into a discussion about it. And I learn a lot just having a discussion. And guess what? They don't unsubscribe, right? Like, because you open up that doorway and you lead with curiosity. It's sometimes very hard to do. It's also exhausting, but I think what's also needed in this moment.
Like a theme in your presentation and in your answers here is how much of what you do requires deliberate, careful thought, deliberate, careful word choice, deliberate, careful self-reflection about, are you communicating the right way? And you know, you do something so well that, of course, from the outside, it all looks easy. So thank you for actually teaching us how much hard work goes behind it. Let's talk a little bit about I can imagine. Let's talk a little bit about your actual newsletter. So what impact metrics do you trust, do you care about? Like what are you looking for in terms of knowing that what you're doing is having impact?
I mean, I'm a scientist, right? So there's qualitative and then there's quantitative data. One thing, I mean, you have the metrics, right? You have the reach, you have the open rate, you have blah, blah, blah. I think what's more important to me, the metric I always look at actually, and it's this small metric on the dashboard on Substack, is shares. Like how many times is this email forwarded to someone that opened it? And to me, that's an incredible metric because it shows use. It shows organic growth. It shows that people are sending this to their loved ones, or maybe it's people they hate they're sending it to. I don't know, but they're sending it onwards, right? And so So it's not just metrics, but it's also measuring community. The other thing we measure is not only shares, but like how many comments are in the comment section and how much discussion is getting is happening after this topic. And what is being said on social media around this topic, and really trying to understand the community of which I've built, and continuing to build that community is really important. And then, I mean, revenue too, to like keep a team and stuff. But yeah, so metrics, community, and revenue are the three.
That's very helpful. Thank you. To the audience, I'm going to ask a couple more questions, Dr. Jetelina, and then we'll turn it over to questions from the audience, either in person or online. Let me ask you about something very specific, because you've done work on violence epidemiology. You've done work on gun violence, which is a really fraught issue. So what has that kind of work taught you about balancing data with community values and very different lived experience and very different positions on this topic?
I mean, so I was actually a violence epidemiologist, which means I measured my research when I was faculty is how violence spreads, like infectious diseases. And one of them is gun violence. You can tell I pick like really easy topics. But one thing about gun violence was that what we learned in real time, and that I'm not surprised about, was the need for listening and engagement and meeting people where they're at. My husband's a police officer, and so I got to be incredibly immersed in this tight network of pro-gun dudes, and really got to learn around what is harm reduction look like, and how do you meet people where they are, and what messages do resonate. And guess what? They also very much care about their family and kids not getting into their gun safe. And so it comes back, I know I probably sound annoying, but it comes down to like listening and really trying to co-develop solutions. And when I look back on my journey, I guess that's the theme that's kind of come through. But that stakeholder engagement is absolutely critical if you want to make impact and if you want to be effective.
Let me shift questions. Many health departments have very limited communications capacity. Now, if you're ruler of the universe and you can give each health department a 5-person team in communications, what would they do? What would the team do?
I would have so the challenge right now is no capacity at health departments, like at all, for communication. So one, you have to make it a core capability of health departments. That means having a scientific translator or communicator. That's different than PR. That's different than marketing. So I would have that. I would build data systems to create listening tools. One of my dear friends, Matt, is at this WashU, and he's creating these listening infrastructure to do that in real time of what is on people's minds in the community. I would give them a social media team for sure, like meet people where they're at. Don't put it on only on the public health website. And create like a tiger team of people that can really meet the moment. The challenge is that we're getting fewer and fewer and fewer resources. And so we have to be more and more innovative in how we do this.
Okay, I'm going to ask one last question, then I'm going to turn it over to the audience. What's one myth about the public that you think you wish academics would retire? And as a corollary, what's one practice that you wish every MPH program taught tomorrow?
One myth I would say would be I don't know if it's a myth, but one thing I constantly see from scientists is undermining the intelligence of the public. And I think that I would really love for people to understand that people want more than a couple words stringed together. The second question was, what I would do in Masters of Public Health? I would integrate communications into every single class, everything.
Very good. We are doing something like that. Okay. Let me open it up to the audience. We'll start with people in the room. Who would like to go first? Let's go right there in the back. There's a mic coming just so people can hear you.
Hello, my name is David Pohl. I'm a public health educator. I love so many things you're saying. It's fantastic. Going back to how we socialize professionally, our learners, and many of the people in this room grew up with knowledge is power. And so we continue to perpetuate that in our education. I was talking to a physician, I was a colleague, and about plain language. And he said, we teach that students have to be able to turn on a dime and go from professional speak to talking to your grandmother. But we never say you have to become bilingual in the next 4 years in a whole new field. And we don't build that into the curriculum that allows you to get the same amount of feedback on your plain language use as it does on your clinical use and impressing your professors or passing your tests. So any thoughts about how to address that socialization process of health professions education versus just telling people to use plain language once they go out and talk to people?
Well, a lot of it is practice. And this is, I never got 1 hour of one class on how to communicate in my master's or PhD program. And I think one of the things that we do a disservice to students is not provide tools in their tool belt to go out into the real world. And so, for example, in a biostat class, right, you have to explain what a p-value is. In statistical terms, can you say what a p-value is in plain language? Because that's actually really hard to do. And can you test on both of those? And and so I think that we have to build that muscle. We built the muscle. Like, I knew how to put together a really boring slide deck and a poster for a conference. Why don't we building the muscle for op-eds and 30-second elevator speeches and policy briefs and TikTok videos and all of that, right? And I think that's where I say integrate it everywhere. Is it shouldn't just be one course. It literally has to be in the DNA of everything we do, whether it's designing dashboards, whether it is going up on a panel during an emergency, and whether it's what to wear on PBS NewsHour, right? Like, it's literally an art and a skill that we need to build, and we aren't building it fast enough.
There's a question right here in the front. Christy, go ahead.
Hi, I'm Christy, and I work at the School of Public Health. My mom is on the Zoom, and she's like, ask your question, get it done, because my journey with your newsletter started with my mom. It was in the middle of COVID. We kept getting all of this information, and we're like, what does all of this mean? Until YLE newsletter came out, and that's your newsletter. And I'm like, oh my gosh, Mom, she's coming. She's coming here, and I can talk with her. And I was like, Mom, how would you describe her help to us during COVID? And this was my mom's answer. She was grounding us. Any feelings of panic were reduced or eliminated. So thank you for that. And she also has one more comment. The impact of her newsletter wasn't considered for her tenure. 500,000 readers would seem to be equivalent to authoring a book. So thank you, Mom. Thank you. And everybody here who's MPH and all that other stuff, listen to what she's saying to do, because my mom and I think you are amazing and we appreciate you.
Let me ask you a question from Zoom. The question is, as we talk about uncertainty, uncertainty almost implies weakness. How do you like shift the narrative to make uncertainty strength?
I disagree with it. They may have been a scientist that asked that. Scientists ask this all the time, and I thought the same, right? Is that if you admit you don't know, they're not going to take you seriously. Because we're as scientists, we're supposed to know. I tell you, it is the exact opposite. That if you are very clear in what you know and what you don't know, people very much appreciate knowing where your knowledge starts and where it stops. And I think the more that we can be clear about that, the more trust you actually build. And it's a paradox, but I think it's a really important one that I've at least learned. Like, when I say something I don't know, I get hundreds of messages to me saying, thank you just for saying you don't know. But I will always come back and say, I'll try to find the answer for you. I promise I'll try to find it. And then I come back with an answer if I find it, or sometimes you truly just don't know. And I think that we need to stop seeing that as a weakness because others don't perceive it as a weakness as long as you're clear. And you can say it in a very dominating way too, but like I think that it's what people are craving right now.
I think some of this links to something you've talked about, written about, which is expectation management. Lead us through that. Like, how do you set expectations for the people you're engaging with so that you can make sure that you're all have a common ground for the conversation, either in writing or in speaking, et cetera?
That's a good question. I don't know. No, I think that it's different whether you're in an emergency or whether you're during peacetime. Right? Like emergency, you're going 2,000 miles per hour, trying not to crash into the guardrails. And expectation management, you say, I'm learning with you guys. Like, this is what we know, and this is where we're going. I think it's very different than during peacetime when I'm talking. So today, for example, I had a piece around healthcare. People expect excellence, and people expect nuance from me. And I guess that's the expectation that I've provided to them, but that's what is craved and that's what's expected. And they will let you know when it is not to their liking or threshold. So I don't know. Yeah, I don't,
You see what you did there by saying, I don't know. Like, I actually thought that answer was great.
Okay,
So,
there you go.
Other questions from the audience? There was none.
Hi, Katelyn. Thanks for being here. Andy Bursky. I'm a longtime listener, first-time caller. So this would be hard enough if you were talking into a community where people come from different places with different expectations and maybe different politics. But what to me makes this so much more challenging is that you're talking into a world in which there are malign actors, where there, I know we can't use the word misinformation, but there is the intentional spread of falsehoods for people who have different motivations, who are not motivated to see their community healthy, but are motivated by other either personal or malign interests. So how do you think about managing into that communication, which sadly is a healthy component of the total, universe of communication out there?
This is like one of the challenges of the moment, like you said, especially since some of the leadership in HHS right now too. I think though that usually I don't name names when I'm talking about a subject. I think though that changes when there are people of power that are making health decisions based on you. And so I do name names now if they're in a place of power. I think that though you have to be really careful about that, because when you start naming names, and if your objective is to reach other people that truly believe in this person, then that's not going to necessarily set new foundations of trust. So for example, when I work with Maha, they love Bobby. I mean, they will forever go to bat for Bobby. And so if I want, my Maha audience to now read about why I think ACIP is now full of anti-vaxxers, I have to be really careful on how I word that if I want them to keep reading. And so, I don't know what the answer with that is on an individual level basis. I think that there's definitely things we can do on a system level, where we can think through how to make, white coats more accountable if they are profiting on disinformation, or think through how do we work with social media companies. But on an individual level basis, I will be honest, it's really hard to navigate, especially when it's doing deliberate harm.
There's other questions here.
Hi, Caitlin. Thanks for the presentation. My name's Heather Cameron. I have the honor of teaching innovation and entrepreneurship here. And I wanted to come back to your comment about academic entrepreneurship and how we can be thinking about helping public health students and social work students and other people committed to social justice have a different relationship perhaps to risk. So you mentioned learning how to pitch. We try and do that, but can you say maybe a few other things about how, again, we can be more proactive about how our students are approaching the change they want to see?
Oh my God, that makes me so happy. There's entrepreneurship. I mean, this is another thing that I think us in public health do really quite terribly is, we are completely reliant on government funding and not think through innovative revenue streams that could help sustainability of a lot of programs, as well as thinking through like what a market is. I mean, I was never taught any of this, right? Like what is ROI? Like what is the market share? What is like your customer value? And so I think that, yeah, I said a pitch deck. I think just giving the permission to think in this space, I think is really quite necessary in public health. Figuring out how to create a space that you can make risk. I was absolutely terrified to leave my academic position and start a startup company because I had basically no safety net, right? And I think like, how can we create innovation incubators within universities where, right, like where you can start thinking really creatively, hey, it's starting to work. How do we do more? How do we do more? Is a pipeline I think would be really quite innovative and necessary in public health. But just like communication, I think entrepreneurship is not looked at positively in public health. And we need to embrace it if we want to create a landscape where we don't have this cycle of panic and neglect every couple of years from diseases.
You know a lot more than all of us about digital platforms now. You make a living off them. If there were to be one platform rule that you could change, what would it be?
Sandro, you're asking hard questions.
Sorry.
If there was one platform rule I would change, I think that, I don't know if I would change this, but I want to figure out how to do it faster. The community notes in Twitter and X are incredibly effective. The problem is that they're too slow. And so I would actually want to figure out how you have that like fact checking thing faster. I guess Grok is one with AI, but that's not very trustworthy either. So I don't know, I think I'm a little different than a lot of my public health colleagues. Like, I don't think the answer is don't let people talk or to ban them. And in fact, I think that's why I like the Substack platform. The challenge though it has is that we then need to do better. And that's a challenge to us and not necessarily something to minimize of others.
Over there, we'll take two more questions, right in the middle.
Hi, my name is Haley. I am on the communications team for the School of Public Health. Thank you for your talk. I really enjoy everything that you're saying, and I also am subscribed to Tangle, so would recommend to anybody. My question is regarding, my role on the communications team is social media. That also includes, our team does news stories about faculty promoting their research. I particularly do profiles on faculty about their background in public health and the research that they do. So my question is for you, as your experience as a faculty member in the past, how to better engage with faculty to meet them where they're at in regard to communicating, because we send it to them and then they can adjust what it is, and how can we better engage with faculty and anyone at the School of Public Health with a communications lens, with a social media lens, how to sort of speak that kind of language to an audience that is sometimes not used to that kind of thing. So
you're being very kind.
Yeah.
I think the number one thing that would be helpful is storytelling, is try to bring out that really uncomfortable feeling of storytelling. Why do you even get into this? Why do you even care about mRNA in a lab? Like, why are you even like, what is your story and what makes that impactful? I think that, you know, as scientists directly go to abstracts, right? What was the question? What was the method? What was the results? What was the conclusion? And that needs to be completely jumbled up in their head. And they need to get more comfortable with it. So sometimes it's a carrot and sometimes it's a stick. But I think one, it's storytelling. I think two, scientists need to know when to speak up and when best to. And this is where, you know, if there's a topic and you're the comms person, I would have a Rolodex of like, okay, who's my HRT person? Because we just talked about Black Label coming off of HRT, right, for menopause. Who do I call? So really helping conduct the orchestra that way of like, who do I need to reach into and talk? Because when scientists are just like any other person. Like if they go viral, it's like drinking the Kool-Aid. They're going to love it, right? They just need to understand and see the impact and that people do care. And that they are doing incredible work. They just need to be better navigated through that. And some of that is, some faculty will never be willing to be navigated through that, but I will say a lot of faculty I think would be. And so you have to find those that are willing to experiment too.
There was one other question here.
Oh, upstairs.
Hey everyone, sorry, I think we're on the same page. I come from the social work background, that's why I'm here for class tonight, not the public health background, but I've been having great luck with social media outside of academia. I think academia is entrenched, it's slow moving, it is bureaucratic. So what I've been doing, like this morning, I made $175 in 5 minutes based on a Facebook post so that I can hand out bus tickets to people on street corners, and $175 in 5 minutes. I'm finding in academia, if I go to the public sector, like let's say tomorrow night I'm having dinner with the mayor of U City, who's also a millionaire franchisor and has background in trusts. So I'm having dinner with him and then we network. Then when I come back to academia, I have a list of professionals in the leaders in the industry. And I go to my professors, and if they answer their emails to meet with me, I have a backup of 5 professionals who I have vetted these ideas with. And then hopefully academia listens to professionals that are outside of academia. And I'm just screaming because I don't have a microphone, and I do have a vocal performance degree master's from WashU. I've taught voice lessons at this university to undergrads, but now I'm in social work. So it's fun that we get to kind of work together with public health. But I do think that there are creative ways to get around academic bureaucracy.
There is, yes.
Last question over here.
Hey, my name is Juliana. You mentioned that 70% of your subscribers are MDs or PhDs. So my question is, if you want to, I'm trying to do the same that you're doing, but with the population that don't have a scientific background, and it's way more difficult because the scientists have the interest of what you are talking about. The people without a scientific background, they don't have the same interest about wanting to improve their health. If you wanted to switch to write for the general population, how will be your approach to tackle that part of the interest of people? And a second question, sorry, you mentioned a team. You have a team that you work with. When did you know that you needed a team to continue growing? Thank you.
Amazing questions. First is, how do you communicate, or how do you start communicating with the general public? The first question is, what do they care about? I think too often us in public health come into communities or want to start communicating about the thing we care about, but very often it's not what they care about. And so, for example, I have this program where we're working in rural communities around equipping and figuring out the power dynamics of how information flows in rural communities. And we, ask, what do you guys care about? It's not about vaccines. If one community really cared about how they can protect themselves from fires and protect their houses. And I was like, great, we can find that information from you. It is not me, but I will call someone that we can answer those questions. So it's really flipping the script of like, what do they care about and how can we bring it to them? That's really important to build. Then when there's an emergency like COVID or Mpox or H5N1 or whatever, we're already engaged, where then they hopefully will listen to me too, because this is what a time that I need them rather than them. And so I think that's I would just flip it, like figure out what they do care about and go find those answers for them and equip them in those. About the team, I was a one-woman show for like 4 years, not sustainable, I'll just say that. And I made a deliberate decision last year to build out a more sustainable team. And so now we have about 20 people, and they're rock stars and incredible. And it's this wild startup culture that I never thought I would ever be a part of, but it's really fun. And they bring, the thing that I love about building a team is the knowledge and life experiences from many different angles, and how much of a better product that is created because of that.
Very last question from me. What gives you hope in the moment?
What gives me hope? Honestly, when I say that we need to do better, there's not tomatoes thrown at me. Like, I think that what gives me hope is that people are willing to listen and to reimagine. And because that's what's needed in this moment. The other thing that gives me hope is going to universities and seeing fresh faces and students and the energy that is needed in the moment. So we'll get there, guys. We'll get there. We just need some work, and it's going to take all of us at once, but we'll get there.
Thank you for everything you do. We'll just like to invite Professor Adia Harvey-Wingfield from the Public Program and Public Scholarship to make concluding remarks.
Thank you. This is on? Okay. Thank you all so much for coming and being a part of this. And a very sincere thank you to Drs. Galea and Jetelina for being part of this event. As you know, we are sponsored by the School of Public Health and the Office of Public Scholarship. And I think this event really underscores and ties together how those two entities at WashU are really working in symbiosis and in connection. Public health is obviously about the science of protecting communities and providing more information and safeguarding the health of the public. And our Office of Public Scholarship, I think, really draws from the principles that Dr. Jetelina outlined of making these connections and building trust, forming these relationships with people, and being able to be brave and to reimagine new ideas of communicating. We're in a moment in time, as Dr. Jetelina underscored, where this idea of facilitating this trust and building this trust or rebuilding this trust from universities outward is really critical and very essential, and maybe has never been underscored before in this current way, how fragile that trust is and how important it is for members of universities to be able to make those communications and make those connections to larger audiences. But this is a core part of what we are doing in the Office of Public Scholarship. It works very closely with what's happening in the School of Public Health, and I'm really excited to have had the opportunity to be a part of this event and to showcase how both of those things work well together. So with that said, I know I'm standing between us and a reception, and I don't want to be in that position, so please feel free to stay a little bit afterwards and join us for some circulation and mingling, but please join me once again in thanking our panelists and our speakers.